Good morning, Mr. Kaminsky. Hi, I'm Dr. Choi, and this is student Dr. McNeil.
Hi.
I understand you're experiencing some palpitations in your chest. How about you unbutton your shirt so I can take a listen?
Sure.
I see we already took your blood pressure.
226 over 117.
That's high, isn't it?
A lot higher than I like to see it, yes. All right, take a deep breath for me. And exhale. Then another. Exhale. Bilateral crackles with mild bronchi.
That didn't sound good.
Not time to panic yet, but it's good you came in. I want to run a few tests and give you something to bring down that blood pressure. Excuse me. Hey, Hank. Start an IV and give 20 labetalol, please.
Absolutely.
Let's get a CBC, CMP, troponins, and set them up with an EKG and renal ultrasound.
Okay.
Hey, Hank. Everything all right? Where you going?
Is he okay?
I'm sure it's nothing. Terry, clean this up and let's get that IV started.
All right.
It's okay.
Hey. What's going on?
Joy,
Yeah.
I just checked in on Mr. Kaminsky. Nurses still haven't drawn blood or sent him up for scans.
What are they waiting for?
Don't know, can't get a straight answer. Want me to do it?
No, I'll handle this. Hey, why is nobody filling the orders for my patient in 5?
Got busy.
I need that workup now. Will you do it, please?
Sorry, gotta give Stat Night Shoulder treatment too.
April. Doris, I need you to draw blood in 5.
I'm sorry, I'm on a break. I gotta clock out.
Draw Mr. Kaminsky's blood first, so don't bother clocking back in. Mags,
Yeah.
you gotta rein in your nurses. They're dropping the ball on my patient in 5.
Dr. Choi, we're down a nurse. We'll get to him.
Ow! Ow!
What's wrong?
She's hurting me.
His veins are impossible, and he keeps moving. Stay still.
Ow! Stop stabbing me.
Doris.
There we go. All done.
Suddenly don't know your way around a rolling thing?
That was a hard stick. I gotta run this to the lab.
Mo, talk to me. What happened with Hank today?
Nothing. He wasn't feeling good.
Monique,
You have to ask April.
I'm asking you. We're talking about patient care here. This is serious, all right? Monique.
Your patient's a child molester. He was Hank's piano teacher. He raped him when he was a little boy.
Please tell me this wasn't your idea.
What?
You know how unethical it is denying a patient care. Treat him like a pincushion. I should write you all up for what you've been doing.
Do you know what that guy did to Hank? He molested him, Ethan. Regularly. During their piano lessons.
It's terrible. I know. But it's not up to us to dole out justice. Hank should call PD, press charges.
He did already. But it was Hank's word against Kaminsky's, and the judge dismissed the whole thing before it even went to trial. Yeah. And since Kaminsky wasn't even convicted, he's not registered as a sex offender. For all we know, he's still doing this to other little boys.
Look, I get why this upsets you. It upsets me too. But regardless of how awful this patient might be, we have an ethical obligation to treat him as we would anyone else.
Fine. But there's nothing that says we have to make his stay a vacation. He will get the bare minimum from me.
Look, if that's how you feel, maybe it's better you keep away altogether.
No problem.
Mr. Kaminsky's EKG and scans are done.
Your labs came back negative. I'm not seeing any tumors or lesions.
That's good, right? Can I go home now?
You'll need to follow up with the primary care physician, but it looks like you're responding to the labetalol we gave you, so hopefully we can discharge you soon.
Thank you.
One last thing. I didn't ask you earlier, but hypertension can often be made worse by things like work-related stress.
That wouldn't apply to me because I've always loved my job.
What's that?
I teach piano at my house for over 30 years now.
You have a lot of students?
Not to keep me occupied.
Pressure drop.
No pulses in V-fib. Peristaltic compressions? Doesn't make any sense. He was fine 5 minutes ago. Say you're staying away from this patient.
He pushed the call button. No one else was around.
Charge 200.
Charged.
Clear.
Still in VFib.
Push 1 milligram of epi. Charging 200 again.
Charged.
Clear.
He's asystole. I think he's gone. Dr. Choi.
Time of death, 1442.
Not sure what I'm missing here, Dr. Choi. The patient responded to the labetalol, so how do you have a massive cardiac event out of the blue?
I'm not sure.
I know they're pretty rare, but at first I thought maybe a pheochromocytoma was responsible for spiking his BP, but I don't see any tumors on these scans. There must have been some other factor at play, right?
How many doses of epi did we give Kaminsky when he died?
According to the case notes, 1 before he went asystolic. Why?
There's 4 empty amps in the trash.
Really? How could that be?
Follow the body down to the morgue, find Dr. Shore, and ask her if she could tell me how much epinephrine Kaminsky had in his system when he died.
Okay.
And ask her to keep it off the books.
Off the books.
Just do it. I got a preliminary report back from pathology, and there was evidence Paul Kaminsky had high levels of epinephrine in his blood when he died.
So,
I'm not sure he died purely of natural causes, and I need you to help me understand what happened.
understand what? Are you accusing me of something?
We pushed 1 amp of epi when he coded, right? April, I found 4 empty amps altogether in the trash afterwards. I can't seem to account for the other 3.
Maybe another patient coded in that room right before Kaminsky.
Nothing was logged.
Maybe they forgot to log it. I don't see what this has to do with me.
You were in Kaminsky's room just before he crashed.
You think I killed him?
I'm just trying to understand how so much epinephrine got into his system.
I don't believe this.
April, please, just tell me what you were doing in that room.
He was dehydrated. I gave him a glass of water.
So suddenly you're Florence Nightingale to this guy?
I think we're done.
April, please. Just... You gotta be straight with me. I'm trying to protect you from getting in any trouble here.
Really? Because that's not what it feels like you're trying to do.
Heads up, Choi. We're reviewing the Kaminsky case for tomorrow's M&M.
Okay.
I see you didn't put down a cause of death yet. Something holding that up, or is that just an oversight?
Sorry, I just need to check something first.
I need your John Hancock before the end of the shift.
You'll have it.
Well, if something caused this guy's epinephrine levels to spike, it's going to be on the adrenals, but I'm not seeing anything.
Could you give them a closer look? Something's gotta be there, I know it.
I'm not supposed to be doing this without a formal inquiry.
I know. Believe me. You're doing me a huge favor, Nina.
You're going to owe me for this one. All right, let's see. Well, I'll be darned. Huh. Look.
I can't see anything.
There's your culprit. Looks like a pheochromocytoma. It's too small to show up on the scans. Must have been what caused the high levels of epinephrine in this guy's system.
So he died purely of natural causes?
Sure did.
Thank you. You're the best.
What's this?
This is what killed Paul Kaminsky, an adrenal tumor.
Okay.
I am so sorry, April. That was wrong with me.
No kidding.
If I'm being honest with myself, I think I was hurt that he didn't trust me enough to read me in. And then I started to mistrust you as well, and...
Well, maybe I shouldn't have cut you out.